Then our supinator, we're gonna start from a neutral position and then bring your arm out like that. So you can see a little bit of the biceps brachii, just kind of twitching, firing a little bit. Nothing too noticeable, but we wanna make sure we're on the correct bony landmarks. So you find the lateral epicondyle of the humerus and then keep, yeah, supinating. Great. Awesome. And then if I go from the olecranon process, I can go down here, and then we start to feel a muscle pulse. That'll be the supinator crest of the ulna. Perfect. It goes down probably like to the upper third of the ulna, and then we're going to insert on the lateral and proximal 1/3 of the radius. So it's going to wrap. It's really hard because it's going to go around
that way.
This direction. Yeah. And it's going to pull it into supination. And so the muscle fibers are going to be here. And then keep supinating. Yeah. And the radius is moving while we do it. So I'm going to resist supination. So turn your palm face up and relax. Yeah, relax. You're good. And again. Relax. And pulse. Okay, we're getting a little bit more here, but it is really deep to all of these forearm extensors and then forearm flexors. So the supinator is almost like right in through here. And then bring your palm face up. Yeah, right in there. So it's gonna be a little bit harder to get the insertion on the supinator, but if you remember that it goes laterally and it comes to the lateral aspect of the radius, you can get like the posterior or kind of the slightly anterior lateral aspect of the radius.
That's right there.
Yeah. And then supinate. Yeah, there we go. That's much more palpable. So kind of right in between if you dive past that extensor group. And then it's innervated by the radial nerve and does just supination of the proximal radial ulnar joint. Awesome. All right. And then we have 3 different muscle tests for this. So just to go through, there's going to be the one in the position that we have right now, which is going to be the most common and the best test, and it does test biceps with supinator. So if we're trying to figure out, can they do supination as a functional action, this is great because we're going to get supinator and biceps involved. And then we're going to turn his wrist in neutral, and then on the opposite side, get him to supinate and bring your hand palm face up. I just need to change my pressure. There we go. And turn palm face up.
So this way.
Yeah, turn it this way. Perfect.
Gotcha.
For 5, 4, 3, 2, 1. So play with the hand position and find what feels comfortable to you in terms of resisting, and then also for your client as well. And I find if you're not grabbing the whole wrist, then it's a little bit easier to just give a little bit more resistance to where you're getting the actual movement from. So that's the first test. And then the second is second and third are to take biceps out of the picture. So we'll do the short head of the biceps, or shortening the bicep first. This one can cause a spasm in the biceps. So if someone has like tightness in the biceps or is easily fatigued, then this might not be an effective test. So we're going to shorten the biceps as much as we can, bring them up a little bit into flexion, and then from here I'm going to get you to supinate and turn your palm face down. So I'm going to grab here. I'm going to try to push him into pronation for 5,
Fingers are
4,
swaying.
3, 2, 1. So it's a little bit more awkward, but it does take the biceps out by reducing the length of the biceps. 3, 2, 1. Perfect. And then I'll get you to sit up. And this is going to reduce the biceps by putting them on a lengthened position. So if we have it in supination here, we're just going to extend, and then I'll get a little bit of slight pronation. I'm going to get you to try to turn your thumb up towards the ceiling. Resist for 5, 4, 3, 2, one. So you can do that with one hand. The glenohumeral joint tends to get a little bit more involved with this position, so we try to do some external rotation to aid in our supination. So those are factors to consider. Typically the supine, keeping the elbow at the side to isolate pronation and supination at the proximal radial ulnar joint is the best position. But know those other two, and the reasons why they're done is to take biceps out. Awesome. So we're gonna spend the rest of the class